Hello, this is Tim Martindale again. Welcome to my series. On part 2, we're going to talk about oxygen. There are some things about oxygen that maybe you didn't know about. But first, let's talk about atmospheric air in general. When we take a breath in, what we're doing is, if these are my diaphragm muscles, we're contracting the diaphragm muscles, which is allowing air to flow into our lungs. Because by contraction, we are setting up a negative intrathoracic pressure relative to the atmosphere. So we're breathing air in. Well, what is air made up of? Predominantly, the most important thing to understand about air is that most of it is nitrogen. And actually, nitrogen makes up 78% of the air that we breathe. Nitrogen is considered to be inert. In other words, it has no effect on the body or any other living substances that we know of. So the predominant air that we breathe in is nitrogen. The second most prevalent is oxygen, which is, we say, 21%. So when we say that somebody's breathing room air, what we mean is they're breathing in 21% oxygen. Actually, it's 20.958%, but we just go ahead and round up and we say that it's 21%. The next is argon. Argon is at 0.9% of the air that we breathe. And again, it's inert. It doesn't do anything for us. CO2 is 0.03% of the air that we breathe. And the rest is made up of some other trace elements that have no bearing on how we live. The thing to remember about oxygen, though, way back 30 years ago, 30 to 40 years ago, they did a lot of work with oxygen, and we were very worried back in the day about oxygen toxicity, because oxygen is a double-edged sword. In other words, you need it to live, but too much oxygen can actually cause pathology to the lungs. That's O2 toxicity. The other thing that we learned, again, a long time ago, is that babies that are born premature, neonates, we could not put them in an incubator and provide them with too much oxygen, because if we did, that caused damage to the retina of the eyes. We called that retrolental fibroplasia. And a good example of that is Stevie Wonder. Stevie Wonder is blind because when he was born early. They put him in an environment of 100% oxygen, and that caused damage to the retina, which is why he's blind. So when we talk about O2 toxicity, what is causing toxicity? Well, if you go back to your chemistry days, there are things called free radicals, and oxygen has 3 free radicals. And those free radicals are what cause damage to tissues. And those free radicals are called hydroxyl, parahydroxyl, and superoxide radical. They cause tissue destruction. Now, our body was designed so that we could handle those free radicals. Our lungs actually produce a substance called superoxide dismutase, and that is secreted from the type 2 pneumocytes that are inside the lung. The superoxide dismutase nullifies the effects of high levels of oxygen because of those free radicals. Even with that said, most people probably would start to develop signs of pathology if they were on 100% oxygen for as little as 3 days. It actually causes destruction to the tissue bed, and on a chest x-ray, it would mimic what looks like a pneumonitis, a restrictive lung disease. And so, as best we can, we want to limit as much oxygen as possible when we are treating our patients. They say up to about 40 to 50% oxygen, and you can go for a long, long time without developing any ill effects. But if you go over 40% to 60%, 80%, 100%, the higher the percentage of oxygen goes, the less time it's going to take to cause damage to the lungs. because of those free radicals. Another concept that I want to talk about, because we'll be talking about this more in future episodes, is the concept of effusion versus diffusion. So effusion is identified, or the definition of effusion is a substance moving from an area of very high concentration to an area of very low concentration. As an example, if in the corner of the room I opened up a perfume bottle and the class was sitting here, sooner or later they're going to start to smell that perfume. Even with classmates in the other side of the room, over time, because it's in such a high area of concentration, they will smell it over there. That is called effusion. Again, it's moving a substance that moves from an area of very high concentration to an area of very low concentration. Diffusion is the same concept, except now we have a membrane. So we open up that perfume bottle, and those that are around it start to smell the perfume. That's effusion. But if I put up a big membrane right across this room, and now students on this side started to smell it, that's diffusion, because it's moving from an area of very high concentration to an area of low concentration, but passing through a semi-permeable membrane. And that's important, because that will explain later on how we move gases into and out of our lungs, into our bloodstream. And that'll be the next episode. Thank you very much.